want you to take a second to think of the name and picture the face of your third grade elementary school teacher. Can you see them? Well, if you're like me, then it probably took you a little bit longer than you expected. It wasn't that easy. Okay, now I want you to try another one. Now, I want you to take a second to think of the name and picture the face of someone you know who has difficulty with substance use. That one, unfortunately, didn't take so long, right? The reason for that is because currently, 1 out of every 12 people in the United States lives with a substance use disorder. And to make matters worse, only 1 out of every 8 people with a substance use disorder actually gets treatment for it. Remember, the opioid epidemic is still very much present. And tragically, we continue to see over 125 people die every single day in the United States from an opioid overdose.
I know. This is all sounding pretty pessimistic, but it's not. And there's a reason for that. And that reason is because there's hope. And what makes me most hopeful and optimistic about this very serious public health issue is that in this case, that hope just happens to be you. As a dental student, you are in a very unique position to help. The information that you will learn throughout your dental training will ultimately become the foundation for your future clinical practice. Each new piece of information you learn regarding substance use disorders could translate into saving a patient's life one day. What an amazing opportunity.
This curriculum is made up of 3 different modules. Module 1 is the Foundation Knowledge module, and it's made up of 10 different sessions. Each session is specifically designed to answer several key questions regarding substance use disorders. Questions like, what is substance use disorder? Why should dentists even know or care about patients who have substance use disorder? What is the neuroscience underlying substance use disorder? How do I find out if my patient has substance use disorder? And how can I help a patient with substance use disorder? What are the medications that are evidence-based to help patients with substance use disorder? And how will my practice affect patients with substance use disorder?
Next is Module 2, which is a small group, case-based series. Here, you'll have the opportunity to collaborate with other dental students under the supervision of a preceptor and closely examine 3 distinct clinical cases related to managing substance use disorders in the dental clinic setting.
Finally, there is Module 3, which is a state-of-the-art, virtual, standardized, objective, structured clinical examination, also known as an OSCE. In this module, you will observe a virtual interaction between a third-year dental student and a dental patient. You will then be tasked with integrating the observations you've made with the knowledge you've acquired in the preceding modules to develop an intervention and treatment plan for a dental patient who has been found to have a substance use disorder.
Folks, we completely understand that dental school is already really hard and there's barely enough time in a day as is. So what we have done on our end is to make sure that we streamlined the curriculum down to its essential elements. And in doing this, we feel extremely confident that this curriculum will provide you with the most current, evidence-based knowledge, clinical skills, and best practices to most effectively identify, manage, and refer dental patients with substance use disorders.
Because the fact of the matter is this: substance use disorders affect our family, our friends, our patients, our community, and sometimes even ourselves. We're all in this together. We all have the power to help. Welcome to the team.